Thank you for joining us today. We have with us Dr. Patrick Quaid, who's an optometrist at the View Cubed Therapy Clinics in Guelph in North York, Ontario. He's an author, and we have another author with us today as well, Elaine Uskoski, who is an author, speaker, and coach, and she's a special interest in the areas of video gaming addiction. Thank you both for joining us.
Thanks for having us.
Elaine, you've been doing this for a long time, and you have your own personal experience. What are some of the things that parents should watch for when they look at patterns and behaviors of their children? What are some warning signs that might be there that would help them identify sooner that something might be a concern when it comes to video gaming addiction?
I mean, I guess one of the most obvious ones is that the child just can't put the video gaming down no matter how many times you ask them to. But more importantly, what's their reaction to that when you do ask them to? Are they having complete meltdowns? Is it something so distressing they can't manage their emotions when they're asked to stop gaming? Are they struggling with school? Has school grades changed, or were they always struggling with school? In my son's case, sleep patterns have changed because kids are staying up too late at night gaming till all hours of the morning, and then it's difficult getting them up in the morning. A lot of kids, they stop coming out of their rooms. They stop eating meals with the family at the table. They're eating meals at their gaming consoles instead, or they're not eating. They're starting to ask for caffeinated sugary drinks so they can stay awake a little bit longer. They've stopped engaging in sports or activities that they used to enjoy. They've stopped engaging with family and stopped wanting to go to family events. Those are probably some of the larger aspects of warning signs in terms of gaming.
What kinds of things do you see as early warning signs when it comes to learning and visual skills for children from your patient experience, Patrick?
Well, I think I would look at it more from the lens of, is the kid thriving in school? And this is where I go back to the 17 visual skills, which we talk about in our book is, 2020, I can see size 20 font from 20 feet away. It is made out to be the be all and end all. I mean, there's 16 other visual skills like convergence or tracking and those are critical things to assess. So I think from a big picture standpoint, is the kid thriving at school? So are they not just, are they pulling down A's? Are they enjoying being at school? Do you see them reading when you're not prompting them to? Do they pick up a book by themselves? And I think it's because when the kid's not succeeding at school, typically what you then see is that behavior where they're trying to find something as a way of getting away from that to find a community that they fit in with. And I think that's what I tend to see. And the other thing I hear a lot from parents is almost like an ADHD type behavior from the child, where they have a really hard time hunkering in on books and studying in school. Now, obviously the opposite may happen with gaming, where the kid is like literally stuck to a computer screen for 8 hours and they forget to eat. But, from a schooling perspective, it's really important to realize that the DSM-5 criteria, so the symptoms that have to be there to diagnose ADHD, which have to be there in multiple scenarios. So if a kid's really able to concentrate on a computer game for hours, but then struggles with reading and print, that's not necessarily ADHD because it's not there in all arenas. But you have to keep in mind that approximately 60% of the symptoms of ADHD are exactly the same as the symptoms of eye teaming and eye focusing disorder. So, and in fact, the DSM-5 says, you can, what's the wording? It says, in the absence of other neurosensory disorders, the following symptoms apply for ADHD. So in other words, you cannot diagnose ADHD if there's another neurosensory problem going on. And if vision occupies 40 to 50% of the human brain, well, if I have an eye teaming issue, I'm pretty sure that qualifies as a neurosensory disorder. So their own manual says you got to check for this type of stuff first. And so what I tend to watch for is quite simply, is the child succeeding at school? And do they seem like they're thriving and not just surviving in the classroom?
Yeah, and Jake, I had him tested when he was young and no learning disabilities showed up. And when he was in a severe gaming addiction, I took him to the doctors and he was diagnosed with severe anxiety, depression, and ADHD, which boggled my mind because that had never shown up. Why is it now showing up at 19? And 2.5 years later, after, detox and relapse continued repetitively, and he finally committed to stopping gaming, within months, the ADD symptoms were disappearing. the anxiety was manageable and the depression was gone. So, I had to question just how much of the aspect of gaming was creating this behavior. And as well, I had taken him to the doctors at age 7, and then he'd seen a neurologist at 14 because I was concerned about some tics, some facial tics, and some throat tics that he was making. And he also was diagnosed with mild Tourette's. And, down the road, when he committed to no longer gaming anymore, the tics disappeared. And so had the doctors asked me during those assessments, how much time is he spending on gaming or on a screen? We might have recognized that the tics were as a result of that. And same with the ADHD. We clearly see now that was part of the gaming problem.
Yeah, and I think what's interesting is when you look from an ADHD perspective, it's, there's no blood test, there's no MRI, there's no objective testing for it. It's purely a behavioral based diagnosis. And I think while that's okay, there's the caveat of, well, okay, we got to be careful that other things can cause those types of behaviors. So we mistakenly label that child. And when you think about gaming as well, not only is it an escapist behavior, I'm trying to play gaming because this is where I fit in. There's also the notion of when I'm looking centrally, I'm actually ignoring peripheral vision. So peripheral vision is a really important part of your visual system. In fact, you only use about the central 6% of your vision for the 20/20 high acuity. I mean, if you can test that very easily by looking at a particular place and then without moving your eye away from that spot, seeing how much of the periphery is actually clear, and it's actually very little. So when you're on a computer screen for hours and hours on end, you're actually training the brain to not really attend to the periphery a whole lot. And I actually think long-term, there is absolutely going to be a consequence for that. I mean, when you're outside of a computer screen environment and things are moving in your periphery, you're probably going to have a harder time processing that peripheral motion. So for example, if I'm in the classroom, I'm looking at the teacher and something moves off in my periphery. Well, if I'm confident with my periphery, I can say, well, that's little Johnny moving his right hand. I don't have to disengage from looking at the teacher to look over and check out what the kid's doing. So that could be the kid that just goes squirrel, any sort of movement and they're gone. But you put them on a computer screen, they're locked in and zoned in because they, quite frankly, I don't mean this unkindly, but they don't care about what's going on in the periphery. They're so engaged on what's going on the screen. And I think that over centralization of vision, if I want to use that term, I think long-term is absolutely going to have a detrimental effect. I mean, there's been studies that have come out of the UK and Australia that have shown, one of the best predictors of whether somebody will become myopic or not or short-sighted. So their near vision's good, but their distance vision's blurred. One of the strongest predictors is number of hours spent outdoors, which is going to stimulate peripheral vision. So I think there's not only a behavioral component to this, I think there's actually a physiological visual stimulation component or lack of from a peripheral standpoint.
We've been enjoying conversation with Elaine Uskoski, who's an author, speaker, and coach, and her interests in the area of video gaming addiction have been very helpful for us to hear today. We're also speaking with Dr. Patrick Quaid, who's an optometrist with the ViewCube Therapy Clinics in Guelph and North York, Ontario. He's the author of the book, Learning to See, Seeing to Learn, Vision, Learning, and Behavior in Children. Thank you both for sharing with us today.
Thank you.
Thanks for having us.